Hi guys, welcome back to my YouTube channel. Today our topic of discussion is skull. The skeleton of the head is called skull. It consists of several bones that join together to form the cranium. The term skull also include the mandible or lower jaw, which is separate bone. Now we will talk about the skull joints. In the joints in the skull are mostly sutures. A few primary cartilaginous joints are three pairs of synovial joint. Two pairs of synovial joints are present between the ossicles of the middle ear. One pair is largest temporal mandibular joint. The mobile joint permit us to speak, eat, drink, and laugh. Sutures are plain intranasal suture, serrate coronal suture, denticulate lamboid suture, squamous parietotemporal suture. At anatomical position of the skull can be placed in proper orientation by considering any one of the two planes. Right space line is horizontal line obtained by joining the infraorbital margin of the center of the external acoustic meatus. Auricular joint. Francoid horizontal plane of the orientation is obtained by joining the infraorbital margin to the upper margin of the external acoustic meatus. Method of studying the skull. Superior view, posterior view, norma verticalitas, norma occipitalitas, norma frontalitas, norma lateralis, and norma basilaris. The whole skull can be studied from the inside internally after removing the roof of the calvarinia or skull cap, as is seen in this picture. Now we will talk about peculiarities of the skull bones. Base of the skull ossify in cartilage with the skull cap ossifies the membrane at the birth. Skull comprise one table only. By 4 years or so, two tables are formed. Between the two tables there are dipoles, double spaces containing red bone marrow forming RBCs, granule series of the WBCs, and platelet. 4 diploic veins drain the formed blood cell into the neighboring veins at the birth. The 4 angles of the parietal bone have membranous gaps or frontalis. These allow overlapping of the bone during the vaginal delivery if they required. These also allow skull bones to increase in the size after birth for housing and delicate brain. Some skull bones have air cell in them and called pneumatic bones. They reduce the weight of the skull, maintain the humidity of the inspired air. They give response to the voice. They may get infected, resulting in the sinusitis. Skull bones are united mostly by the sutures. Skulls are foramina for imagery vein which connect the intracranial venous sinuses with the extracranial veins. They try to relieve raised intracranial pressure. Infection may reach through the imagery vein into the cranial venous sinus as the veins are valveless. Petrostemporal is the densest bone of the body. It lodges internal ear, middle ear, including 3 ossicles, malleus, incus, stapes. Follicles are bones within the bone are fully formed at the birth. Skull lodges brain, meninges, CSF, gland-like hypophyses, cerebri, and penile, venous sinuses, and teeth. Special senses like retina of the eyeball, taste bud, tongue, olfactory epithelium, cochlear and vestibular nerve ending. Exterior of the skull is norma verticalis shape. When viewed from the above, the skull is usually oval in shape and it is wider posteriorly than anteriorly. The shape may be more nearly circular. Now we will talk about the bones. Bones seen in the norma verticalis. Upper part of the frontal bone anteriorly, uppermost part of the occipital bone posteriorly, and parietal bone on each side. Sutures. Coronal suture. This is the place between the frontal bone and the two parietal bones. The suture crosses the cranial vault from side to side and run downward and forward. Sagittal suture is placed in the median plane between the two parietal bones. Lamboid suture. It lies posterior between the occipital and two parietal bones. It runs downward and forward across the cranial vault. Metopic forehead suture. This is occasionally present in about 3 to 8% individual. It lies in the middle plane and separate the two halves of the frontal bone. Normally it fuse at 6 years of the age. Some other name features. Vertex is highest point on the sagittal feature. Vault of the skull is the attached roof for the dome of the skull. Bryagma anterior frontala is meeting point between coronal and sagittal suture. Lambda posterior frontal is meeting point between the sagittal and lumboid suture in the vertebral skull. This is the site of the posterior frontal which close at birth 2 to 3 months of the age. If you have any query, you can ask in the comment section. Thank you so much for watching the video.